Alternative Cycloplegic Refraction. This is the second lecture for NV 2623, Primary Care Methods 3. As you know, there is possibility that for some patients, accommodation may not be realized completely when refraction is done. Because of that, you will proceed to the cycloplegic refraction to make sure the accommodation is relaxed. In the first lecture, you have learned about the indication and also contradiction of the cycloplegic refraction. With this knowledge, you should be able to do the decision either you should proceed with the cycloplegic refraction or not. This is the list of the indications and also contradictions of cycloplegic refraction. It's just a review from the previous lecture, and I hope you still remember. What you should do for the patient who are not be able to proceed with the cycloplegic refraction. That's why we have the alternative cycloplegic refraction. This is for patients who not be able to proceed with the cycloplegic refraction, but yet still need to control the accommodation when we do the refraction. Whoever have indication for the cycloplegic refraction but not able to proceed to this procedure, you should consider to proceed with the alternative cycloplegic refraction, or we also can call it as overfogging procedure. We have two techniques in alternative cycloplegic refraction that you can choose. Either the first one, which is delay fogging technique, or the second one, we call it as cyclodamia. Delay fogging, or in Malay we call it as pengkabutan berlanjutan. This technique, also known as delay subjective test, which is after the subjective refraction, you will proceed with the negative relative accommodation test, also called as plus lens to blur test at 40 cm with near target, which is the best VA for near, and this is done binocularly. The plus lens power is added binocularly by 0.25 diopter step. Once the target is blurred, you should stop adding the plus lens immediately. Then, remove the near point cut or near target and ask the patient to see the smallest row of letters on the Snellen chart that had been readable during subjective refraction. And of course, it is blurred. Now the plus lens power is reduced binocularly by 0.25 diopter step. Remember, the patient is asked to inform the examiner when the letters clear up, which is the smallest row of letters on the Snellen chart that had been readable during subjective refraction. Once the patient can read, you should stop reducing the plus lens immediately. So, the remaining lens power on the triframe are recorded as the finding. This technique also suitable for patients who comes in the astigmatic symptoms but whose subjective finding turn out to be little different from the present correction. Cyclodamia. This technique needs you to have very good retinoscopy skills. In the delay fogging technique, you will proceed after the subjective refraction, but different with the cyclodamia. You will proceed with the cyclodamia after the retinoscopy. Because of that, the retinoscopy must be perfect. We start with the subjective refraction with the working distance lenses. The spherical lens power is reduced binocularly. You should reduce the power by 0.25 diopter until the best vision was obtained. Once you obtain the best vision, you should stop reducing the plus lens immediately. Now refine the cylindrical correction. This is normal technique same as JCC in subjective refraction, but you need to focus with plus 1 diopter on untested eye. This is to make sure that we have maintaining the binocular vision. Once done, refine the cylindrical correction on the other eye and fog untested eye with plus 1 diopter. After you have done the JCC on both eyes, proceed with the binocular balancing by adding plus 1 diopter on both eyes. Reduce the lens power by 0.25 diopter until the best VA was obtained. So the remaining lens on the tri-frame are recorded as the finding. So what you can see is both techniques maintain the binocular vision and also relax accommodation by using the plus lenses. In conclusion, you should think about patients who have indications of cycloplegic refraction but in the same time have contradiction of cycloplegic refraction. You should know what is the alternative cycloplegic refraction, and in the same time, you should be able to list down the techniques in alternative cycloplegic refraction. You should also be able to explain the procedure of each technique in the alternative cycloplegic refraction. And finally, about the finding, you should be able to do the recording and also know the expectation from the techniques. That's all for now. I hope you understand about the alternative cycloplegic refraction. Any inquiry, please do contact me via email, WhatsApp, and in iFolio. Thank you and have a nice day.